Alright guys, can you get out a pen and paper for me, please? Can you guys get out the paper that we started on the 25th? Michelle, can you find your paper, please?
I don't think I can find it.
What happened to the binder I bought you?
I forgot it.
Okay, so you always start off with what's available. And as you can see, we're starting off with tabs. So as you can see, one tab equals 10 milligrams. So you can start off with that. One tab over 10 milligrams. Michelle, are you getting this?
Yeah, sure.
So as you can see, the order is 20 milligrams. Michelle, since you want to be on your phone, I want to see you answer this question.
I forgot this.
Hi, my name is Diana and I'll be your nurse today. So tell me what brings you here today.
Yes, it's my daughter, Michelle. She's having problems getting up in the morning. She's never on time. She's very impulsive.
What? What do you mean I'm impulsive? You don't know anything. You're spreading around lies. This isn't even your real hair.
Yes, as I was saying, she isn't focusing in school. She isn't doing good. She isn't having good grades. She has difficulty remaining in friendships.
Hey, Michelle, you have the notes from last week's class. I missed last week. Can I borrow them?
No.
Yeah, that's cool. Can I use it for a second? This is how you do it?
No, that's not how you do it.
Yes.
No, you're losing. Look.
She doesn't stay asleep.
I'm ready for my lunch. Michelle? Hey, Michelle. Are you okay? What's going on?
It's just I haven't been able to get much sleep at all.
You're not sleeping?
No.
At home, really?
I can't sleep.
You can't sleep? I'm so sorry.
I just feel like I constantly just have to keep moving. I can't sleep.
Oh, okay. Have you gone to the doctor?
No, not yet. I think my mom's going to take me soon.
Okay. Alright, you can just take a rest. I'll be here.
Alright, thank you.
Sure.
She's always in trouble at school. The teachers are always writing me notes. And I have another daughter, and she doesn't show any of this. And she's the same age.
Okay.
She focuses when I teach. She does everything right.
Okay. Okay, Michelle, I'm going to do a physical assessment on you, okay? And I'm going to need to stay still for me. So put your arm down, okay? I'm just going to take your blood pressure. Can you put your arm down for me? Okay, thank you. So hold on, Michelle. I need to put your arm down. Also, I need you to uncross your legs. I'm going to take your blood pressure, okay? Michelle, tell me how is school going for you?
Well, I mean, it's alright. I don't like it. My classes are boring. I got suspended last week because my teachers call me impulsive, whatever that means. And my grades are starting to slip and I don't really have any friends. I mean, I don't really care about school anyways.
So Michelle, tell me how's your sleeping?
I mean, it's okay.
I
I
see you're
can't...
fidgety. Are you okay?
Yeah, I do this all the time.
Oh, okay. Alright, well, so tell me, are you sleeping at nighttime?
Of course, yeah, everything's just fantastic. It's just sometimes I wake up in the middle of the night and I can't go back to sleep. I can't shut my brain off.
Okay. Did you get 8 hours of sleep every night?
No, I don't think so. Sometimes just 4 or 5.
Okay. Okay.
Okay, Dad, what do you have for me today?
So today we have Michelle and her mom. They came here today. Her mom is very concerned about Michelle, and I did an assessment on Michelle, and I found this information. I want to share this with you. The subjective data, the patient stated that she has a very hard time concentrating and staying asleep. She has a hard time falling asleep and staying asleep. She says that she's always fidgety and that she has a hard time concentrating in school. She's failing at this time. And I found that, like I said, she's very fidgety, constantly moving. She can't stay still. She's very impulsive and aggressive. Her blood pressure was a little bit high. Her heart rate was high as well. And she kept moving her arms. She couldn't follow directions every time I asked her to stay still. And during, when we're talking to the mother, she was very aggressive to the mother. She even pulled her wig off, just very disrespectful.
Good morning, guys. I'm Dr. Camus, and the nurse was telling me that you're having some troubles at home and at school. So we're gonna do some investigation to see what you may have. So some of the labs and diagnosis are gonna be like your past difficulties, your medical history, how you are at home, how you are with your family, your school, how you're sleeping, and we're also gonna do an MRI to see your brain anatomy and function. Okay guys, so with all the labs and tests that we've finished, we've come to the conclusion that your daughter has been diagnosed with ADHD. And what ADHD is, it stands for Attention Deficit Hyperactivity Disorder. So ADHD can simply be defined as a developmentally inappropriate level of attention and or hyperactivity impulsivity. Yeah. So this disease is normally caused by genetics. It's normally inherited from our parents, grandparents, great-grandparents. And if you were smoking or drinking during your pregnancy, this can also be a cause. Or if the baby ever had a head injury that you might have thought was small. So with this disorder, some things you might want to expect or anticipate is behavioral issues, learning deficits, depression, substance abuse, inability to finish tasks, lack of focus, trouble keeping quiet, and poor organization. So this normally affects people younger than 12 years old, and we like to get it treated early to prevent complications later in her life. All right, guys, can you get out your paperwork? Okay, so can someone tell me the signs and symptoms of ADHD? Michelle.
Okay, so some of the signs and symptoms are inability to focus, trouble sleeping at night, and impulsivity.
Excellent, Michelle. Can you stay at the class for a couple minutes? I want to talk to you. So how have you been, Michelle?
I've been good.
So your mom was telling me that you've been diagnosed with ADHD recently, and I've noticed that you've been handling yourself a lot better these past couple weeks. Have you been taking your medication?
Yeah.
I can tell. You know, you should keep on with the medication, and if you ever need any help with assistance with school or out of school, just give me a call and I'll help you.
Hey, Deanna, I'm really sorry about last time what happened. Were you able to get the notes?
I did. Thank you so much. Yes. Thank you for apologizing.
And you were right about the game. I don't think I was playing it right.
Oh.
Can you show me how you did it?
Yeah, absolutely. Okay, so it sounds like your vital signs are good. So tell me, how are you doing at home?
I've been feeling good. I haven't acted out recently, I don't think.
Okay, and tell me how you're doing in school.
I'm doing pretty well. I'm actually passing all of my classes. I'm making friends.
Fantastic. Okay, no issues at home, at school.
No.
And you're taking your medications on time?
Yes.
Okay, have you had any side effects?
No,
No,
no.
nausea, nothing like that? You doing
No.
good? Okay, fantastic. Good job. So continue taking your medications on time, okay?
Oh, thank you.
So our nursing diagnosis is ineffective impulsive control related to attention deficit hyperactivity disorder as evidenced by impulsivity, lack of focus, and poor organization.
Okay, so as far as treatment, some of the medications we like to give are Strattera, clonidine and guanfacine, Focalin, And as far as therapy, we like to prescribe behavioral therapy. We'll also be contacting case management services, and we'll also notify the schools where your teachers can also help out.
Okay, so some of the teaching we can do as nurses is to be consistent and set limits with the person affected. We can also have clear consequences. We can set a daily routine, and we can also avoid multitasking when you're talking to the child and make sure to praise the child for good behaviors. Also, it's important to work with teachers and caregivers to decrease the impact of the condition on your child's life.